My name is Diana Lamson. I'm the one that actually didn't get hit, so it's not a normal TBI. It's, if anything, it's an ABI, acquired brain injury. However, what's the difference? You know, who knows? So what had happened was when I was, see, we're starting already. I can't remember how old I was when it happened, and I should need to. It was October 23rd, 2015. So I was 37, and I decided for the first time in my life to go to a haunted house. And that's how it started. So I was with my boyfriend at the time, and we go through it. It's a very famous one. I'm not sure if I should say the name because I don't want people to think, oh my God, you're gonna die when you go there. So I went to a haunted house. And there was, I'm forgetting words, that's what happens. Maze. You know, there was a corn maze and buildings, corn maze buildings, and you go back and forth, and it's really scary. Yeah. So I was screaming like a crazy person, like really loud, like I would be in a movie, like really, really loud, basically the whole time, to the point that at some point in time, one of these like ghosts said to my boyfriend, "Can I tell her to be quiet?" And then I said, like, I was screaming things like, "You can't touch me, I have children," and I was like screaming the whole time, like really screaming. This makes sense because of the pressure of screaming. Yeah. And we came from corn maze to the last building, and there was a really bright green light that I guess, you know, would just show the light that you're coming into a building so you don't fall or something. But it was really, really bright and really, really green. And we went into the building, and it's dark in there. And whatever happened, we went through there, and we came out, and it was the end. And there was a lit area, and I think they sold hot dogs or like food and stuff. And I noticed that I have dots in my eyes, as if you look at the sunlight, just really, really, like a lot of them. Yeah. The same color as the light was, green. And I thought, oh, well, that's weird, but that happens sometimes. Give it a couple minutes, and it didn't go away. And then I thought, because sometimes before me having low blood pressure, what happens is I get dots and it gets dark, and I put my head down, and then I get blood in my head again, and then it's fine. So I tried that. That didn't work. So I couldn't see out of this eye at all, and I could only see half out of this eye. And I couldn't even drive home because I couldn't see. And then when we came home, headaches started. And at that time I was actually doing online college classes. So for the next 3 weeks, I basically had symptoms of what I would say a concussion, but I never had a concussion, but that's what I heard, where when I look at the lights, like any light would just give me headaches and would be really, really annoying and wouldn't feel good. When I look at a computer screen, I get nauseous really quickly. I was basically worthless at work. I had sometimes headaches, but the worst thing was that my neck hurt, like really, really bad all the time, like really bad, as if I had an accident or something. It hurt right here, it hurt really bad. I've been going to doctors, and I said, I don't know what's going on, like this is what it feels like. They did MRIs or something. I don't know the difference between the MRI and the CAT scan. And they tested other things, and they tested my eyes, and nobody knew what was going on. But basically I didn't really go to work these 3 weeks because I was just sitting in a dark room, and my boss said, like, you're worthless, go home. Not really, he didn't really say that, but I couldn't really do anything because the lights were bothering me, and I couldn't look at the screen, nothing. And then, so that was October 3rd on a Saturday. October 23rd, the day, was a Friday, and I was at work, and I think I was at work for an hour or something, and I really couldn't do anything. I was just sitting in the break room in the dark. Basically, whenever somebody opened the door, like, close the door, because it was so bad, and my boss said, go home. But I worked at a bank. I don't know if I'm allowed to say that. So I was supposed to be closing, which means I can't just leave because you can't just not have people there. So I had to ask somebody to work for me, and that was, yeah, that's sometimes hard to find people to work until 6:30 on a Friday when they were supposed to leave at 4. So I went home, and I have children, so I had the kids with me after school, and my head hurt, my neck hurt, and I was on the couch at about, don't quote me on this one, but like 9 o'clock at night or something, sometime between 8 and 10, I would say, at night, and suddenly my head hurt so bad that I thought it would be exploding. Like, it was really, really bad. Worst pain ever, except maybe childbirth, or maybe the same. Women will know what I'm talking about if you do that without medication. So I just had that pain, like really, really bad pain, and I'm thinking, I think I need to go to the hospital. There's something not quite right. And I went and I called 2 people. So I was able to use my phone. I was able to talk. I was able to move. My body was fine. And I called 2 people. The first person said, sorry, I can't, I'm busy. Because I said, can you drive me to the hospital? And the second person then came and drove me to the hospital. And the whole time, my head hurt. It's really, really bad. So we went to the car, she drove me to the hospital, and I actually remember being at the emergency room, trying to explain to that nurse or whatever this person is that like, takes you in, what is happening or what had been happening the last 3 weeks. And I did, so the only thing that was really, really bad then was that I just couldn't think of the words. And since I'm from Germany, of course, sometimes I forget the words, but then I would probably use, like, this is the German word, like, figure it out. But this time I just couldn't think of any words. And I was sitting here, and there was the nurse on the computer, and there was the person that drove me. And I'm trying to explain what happened the last 3 weeks and what's happening right now. And the whole time I'm like, you know the thingy? You know when the thing and the thingy? And I just expected her to, like, say the word for me, and she didn't know, but it was basically just, you know the thingy when the thingy and the thingy, you know the thingy when thingy, kind of like that. And then they brought me into the ER room. I don't even know what you call all these things. And I was there. And the female doctor came in, and again, I tried to explain to them what was going on, and my head hurt still really, really bad, and I couldn't think of the words, and then I started puking. And I think I was there in that room for until 4 in the morning, until they finally said, we don't know, you just stay here. What they did was, while I was there, they did a spinal tap. Yeah. I think, and when I had my kids, I always thought I never wanted to have that because I'm going to get paralyzed or something will happen, something will go wrong, they can't touch me, and I never had that. But when they said we need to do that, like my head hurt so bad, and I was basically just like, do whatever. I wasn't even arguing, which normally I would have. I would have said, wait a minute, like how dangerous is this? I would have said yes to anything at that point in time because I was just so just hurt and exhausted and not feeling good. So they admitted me, and I was there. So that was a Friday, and I was there, I think, only Saturday. And then again, they said, we don't know what's wrong with you. We can't help you. We're sending you to a different hospital, which they did. I remember they actually tried to do either a CAT scan or an MRI, and I just felt so bad that all I could do was just like sit in a ball, and I was like, I can't lay down. You can't do it. I'm not doing anything. I can't do it, because I felt so bad. And then I remember my daughter was visiting me, and I just like started to cry. Anyway, so they sent me to a different hospital, and I was there till Friday, and they then finally figured out that I had dissections in either 2 or 4 of my carotid arteries, and a blood clot went up in my left side, and then the blood vessel burst, and then I got blood in my brain. So I had a stroke. But they didn't actually tell me then. So for the next like 2 months, I've kept everybody telling this very long story about dissections and blood clots and blood in my brain. And then finally, 2 months later, when I got an appointment with a neurologist, he said, "You had a stroke." So now finally I could put a word to it, because they didn't word it that way and nobody knew what was happening. So I had a stroke. Long story short, what probably everybody will say, what I want people to know is, just because you can't see it and people seem fine, doesn't mean that it's not there. And don't just say, "You're fine." I know I'm not fine, and if I tell you I'm not fine, don't say I'm fine. Don't ever say, "Just do it." That's the worst thing. If I tell you I can't, that means I can't. Then just don't say, "Do it." That's the worst thing. But also, what I want to say is, if you don't have a brain injury, don't act like you have one, because we have enough tough time to, well, first make people understand that there are issues even if you can't see them, but also if you act not right and you're fine and you're just doing it because, I don't know, you are drunk or you're just, I don't know what's wrong with you, then everybody will think, well, this person has a brain injury, which means all people with a brain injury are like that. So we should, I don't know, lock them all away or not even talk to them because they're all idiots. And that's not true, because we are not.